Okay, so a cardiac assessment is very related to the respiratory. Sometimes they have a hard time differentiating what's a respiratory problem and what's a cardiac problem. So initially when the baby's born, we put leads on the baby, and there are just 3 leads. And then we look at color in terms of just inspection. That's all you can really do is look at color, and then we look at actually the rhythm. So sinus arrhythmias are very, very common in babies, and they're pretty benign. Then we look at heart rate, and heart rates in infants are much, much higher than adults. So a heart rate of 180 in a 28 weeker is perfectly normal. And then a heart rate of 100 in a full-term baby is actually quite low. So it all depends on the gestational age of the baby. But typically 140s, 150s for like a 30-weeker or a 32-weeker is pretty average. In the same way as blood pressure is very, very low in a neonate. And generally we don't look at systolic or diastolic in the same way as adults, but they look at mean arterial pressure, or MAP. And so the rule of thumb is that the MAP should be about what the gestational age of the baby is. So a 32-weeker, if the MAP is anywhere from 30 to 40, they're okay with that. And so it's very different than what you look at with an adult. And again, unless the baby is, quote, a cardiac baby and has cardiac issues, then they don't worry so much about the blood pressure. And then, again, they don't palpate the pulse so much. We do not do a brachial or a radial pulse. Even in resuscitation, we do more a carotid pulse, but usually we're listening for an apical pulse. And we just use a stethoscope to listen to the apical pulse. Murmurs are quite common in a baby, and they are very, very different in sound than any kind of murmurs in adults. They're just very soft whooshing sound, and you have to listen very carefully, and it's very hard to hear. But they're usually asymptomatic. And they're from lots of different, whether it's the patent ductus arteriosus or a PFO, patent foramen ovale. There's just a lot of holes that are supposed to close when they're first born that eventually do close. So it's not usually indicative of anything until it becomes symptomatic. And then color, and then percussion. We don't percuss. We generally just look at what the symptoms of the baby are. And again, another thing that we look at is the preductal versus the postductal. The preductal is the right wrist, the O2 SATs. If that differentiates from any of the other extremities, that is indicative of some kind of congenital cardiac defect.